Good evening, everyone. My name is James Schofield, and tonight I am going to be talking about a rare genetic disorder known as Marfan Syndrome. Now, I have been diagnosed with this rare genetic disorder, and so has my daughter. We were diagnosed about a year ago, and it has tremendously impacted our lives. Tonight we are going to be covering what it is, the signs of Marfan's, the challenges that we face, and the treatment plans that are out there for us. First off, you're probably wondering, now, what is Marfan Syndrome? Basically, Marfan Syndrome is a connective tissue disorder that affects our tissue within the body and also affects the organs in the body. A couple of people that have been diagnosed or have at least been suspected to suffer from Marfan Syndrome, there are a couple that I came across. First one is, he has been diagnosed with it, and that is Isaiah Houston. Isaiah Houston is a former Baylor University basketball star, and he was diagnosed back in 2014, actually specifically a couple of weeks prior to the 2014 NBA draft. Many say that he would have made it into the NBA if it wasn't for this condition. The other one, he wasn't diagnosed with it, but we suspect that he had it, and that is our very own 16th President, Abraham Lincoln. We suspect that he suffered from this due to his extreme height. Now, you're probably wondering, what are some of the signs of Marfan Syndrome? What needs to be looked at in order to diagnose it? Well, some of the signs include extreme height, extreme skinniness, which is also known as anorexia, but not all anorexic people suffer from Marfan Syndrome. It's just a sign. Some of the others include being double-jointed, flat-footed, a dipped-in or extended chest, longer ligaments, and being double-jointed. So those are the main signs that the geneticist will look for. Now you're probably wondering, what are some of the issues that we have to, what are some of the challenges that we have to face? What are some of the issues that could possibly happen? Well, the main one is called an aortic dissection. What that is a tear within the aorta, which is the main vessel connected to your heart and pumps the blood throughout the body. In fact, according to one study done between 1963 and 1992, 360 people had to have had an aortic dissection. Out of those 360 people, 40 of them suffered from Marfan Syndrome. Specifically, 24 were men and 16 were women. Another major one is scoliosis, which is a curve within the spine. So, according to the AAOS, which is the American Academy of Orthopedic Surgeons, 60% of children who have been diagnosed with Marfan Syndrome actually suffer from scoliosis. So it's very likely that a person with Marfan's will get scoliosis, especially if they're still a child. Another major one is what is called a collapsed lung, or more technically known as pneumothorax, which is gas or air trapped in the walls of the lungs, and it causes the lungs to collapse and you can't breathe. Marfan's can also affect even your eyes. Now, the main issue that we have to watch out for in regards to our eyes is what is called lens dislocation. which is when your lens pops out and you basically can't see, and that requires immediate surgery from an eye specialist. Now that you know what some of the challenges are, you're probably wondering, what are some of the treatments? Well, there are many different treatments, but the main ones, the first one is medication. A lot of people who have been diagnosed with Marfan Syndrome are put on Lorazepam, which controls the heart, which is a medicine for the heart. Now, I have not been put on that. I was put on a blood pressure medicine called metoprolol to control my high blood pressure. So, some others include spinal taps, a back brace, glasses, cataract removal, surgeries, which that is the major one. So we have to worry about a surgery on our aorta, eyes, lungs, our joints, ligaments, pretty much all of our body. So also we need to plan out our day by day, actually, according to how we feel. One day we might be able to do a lot more, and the next day we might not be able to do as much. And also, make sure to check in with your doctors. Whether it's yearly or every 6 months, whatever they say, make sure you follow that, because that is a huge one. They can catch a problem ahead of time. And of course, if you're having any severe pain, make sure to go to the emergency room. It's better to be checked out and have them tell you nothing is wrong than actually have something wrong with you and not have it checked out. So, now that we have discussed what Marfan Syndrome is, what the signs are, what we could suffer from, and what the treatment plans are, I hope that you have a better understanding of what it is, and if you or somebody that you love, you suspect, make sure to consult with your doctor and get the appropriate testing. Thank you, and have a good evening.